What is up, everybody? So excited to see you here live. I am not too excited to talk about what I'm going to talk about, mainly because this is the first time I've actually started to begin the process of unpacking the whole past 12 years of what's been going on with me and my thyroid. And I'm going to break it up into a couple of videos. This first one's really only my story. I will bring in some education based on the research and the things that I have dove into in the past 12 years. But today I really just want to tell you my story and my journey, because unfortunately what I noticed is that a lot of people are going through the same situation and similar situations than I have, and then we're not seeing the help that we deserve. And so definitely want to bring that to the table for you. First and foremost, though, I'm Dr. Kaylee Simmerman, pelvic floor physical therapist, owner and founder of Down There Docs Pelvic Floor Physical Therapy in Tampa Bay, Florida, where we offer mobile and in-person sessions. Also owner and founder of Femme Empowerment and Advocacy Academy Online, where we offer different types of programs and training programs and platforms and products for you to help you reach your goals and eliminate shame and guilt. And really, the thyroid situation actually is probably one of the main reasons that I'm an entrepreneur. I know that sounds crazy, but the more that I sit back and I really focus on my why and the reasons that I do what I do, the reason that I do pelvic floor physical therapy is because of my own pelvic floor dysfunction. But the reason that I'm an entrepreneur really dives so much deeper in that. It dives into the fact that, of course, I wanted to make more money than I was, because I was being capped as a physical therapist in an outpatient physical therapy world, corporate world. I would never make more money than what I was told I was going to be worth. And I wanted that. And I also wanted time and financial freedom. Time freedom. So the financial freedom, again, making more money, but the time freedom of being able to spend more time with my husband and fly around the world and do things that we've always wanted to do, which of course 2020 had to put a halt on all travel plans, but that's totally fine. But just being able to take off and not have to worry about being in one spot at all times. And so I think that that's been really powerful for me to see. But the more that I've been reflecting and thinking about this, I'm actually recognizing it dives into my health so much deeper, because having a thyroid disorder and learning what I've learned and always being up and down on this autoimmune journey and new diagnoses and new issues and new things popping up has really made me incredibly grateful for my time and incredibly passionate about creating a life by design and creating everything that I want to, but doing it because my health matters. Because when I was 17 years old, and I'll never forget this, I was a moody teenager and more moody probably than most people. I had been on birth control for about 2 years at that point because of menstrual cycle issues like pain and problems that I was having with panic attacks and anxiety and acne and the normal things that they put you on birth control. And again, that's a lot to unpack there, and I will be doing that as well eventually. But I just never knew that there was possibly an underlying issue, because I started to lose a lot of weight, and I thought that losing weight was because I was dancing. Many of you know, many of you don't know, I was a ballet dancer, competitive dancer for about 20 years of my life, probably. I danced a lot. If I wasn't in the studio, I was at home dancing, or I was running, or I was working out, trying to figure out ways to continue to work well. I always wanted to be the skinniest. I always wanted to be the smallest. Body image, shame, and guilt in that realm was a big passion of mine too. So I started to lose weight, and I initially thought that was a good thing. I was like, yes, I'm skinny, I'm tiny. And when I say tiny, I'm talking 98 pounds as a 16-year-old. I only got to about 100 pounds when I was 17. I was a senior in high school in teeny tiny freaking zero size clothes, and it just didn't really look good. It wasn't a cute look. I didn't feel good. I didn't know why I didn't feel good though, and I was just sick. But I ate a lot. My appetite was high. I wanted to eat everything in sight. I ate more than most people can normally eat. I didn't sleep though. I was insomniac through that time. I thought that was stress and anxiety. I was incredibly anxious all the time. My heart was always skipping beats. My blood pressure was always high. I always had high heart rate. I thought that was hereditary. I passed out randomly sometimes, just thought that was fatigue, didn't tell anybody. My periods were a shit show. Shit was not fun at that time in my life. And I remember I never had what they call, and I never say the word right, but the thyroid ophthalmalgia, or wherever your eyes start to bug out. I never had that. So I don't think any of us really thought anything was wrong with me, because at that time, my mom, when she was 35, she had me at the age of 34. And when she was around 35, 36 years old, she was diagnosed with Graves' disease, and they did the radioactive iodine for her. And so she would tell me that they put her in this room. She wasn't allowed to see me, but we just never thought that I had that, because I didn't have the same symptoms she had. We just thought that I was a teenager who was watching what I ate and just worked out too much. And so we didn't think anything of it. And I remember I started to have trouble swallowing, and I had recognized, for a while that I had this Adam's apple. Like, I always had something that was going up and down when I was swallowing. And I had this Adam's apple, and I used to get made fun of at school because they would be like, "Are you sure you're a girl?" "Oh, because it's an Adam's apple." And I just, whatever, you guys don't know what you're talking about. Like, an Adam's apple on a female is totally fine. This is a totally normal thing. Little did I know that that was not normal. And I remember walking down the hall one day, and I was walking down one way, and then the nurse from the school at my high school was walking a different direction. And she was like, "Hey, can you come into my office for a second?" And I was like, "Yeah, sure, whatever, I don't care." So I went to her office, didn't really know what this is about, thought it was just a question about my wellness or my, personal exam, whatever. And she asked me if I had ever had anything checked out. And I was like, "No." And she asked me all these symptoms, and I was like, "Yeah, I mean, I feel that way. Yeah. Like weight loss, hair's falling out like crazy." And I mean, like, pulling my ponytail, like, now there would be a chunk of hair coming out. And she was just like, "I think you need to go to the doctor." And I was like, I'm at the doctor every time I'm supposed to be at the doctor. I don't like feel any different than I have in the past like 6 months. She's like, "No, let's call your mom." And so she called my mom, told my mom that she suspects something's going on with my thyroid because I have an Adam's apple or whatever, and there's this thing. And again, it was progressively getting worse and bigger, and I wasn't swallowing well. But I didn't tell my mom because I didn't want my mom to worry, because my mom was a worrywart. And at that time, we had so many things going on personally in the family that I didn't want her to think that she had to take care of something else. And so with the swallowing and things like that were getting more difficult, this nurse told me to go to the doctor. My mom took me to the doctor. The doctor sent me to a specialist, a thyroid specialist. So I'm from a small town. We had like really poor healthcare there. So I went to the specialist about 2 hours away. The specialist did blood work, did an exam. We went home. We came back. They said, "You need to come back." So we went back, and they told me that I needed to have an emergency surgery. And of course, I start freaking out as a 17-year-old. And I'm like, what the hell does that mean? Do I have cancer? Am I dying? They did the biopsy, the needle, like this freaking huge. And of course, yes, my memory is probably a little flawed because I'm afraid of needles as well. But they did this biopsy of this thing. Thank goodness it came back non-cancerous. However, it kept growing. And so they were like, "We need to take your thyroid out." And that's what the scar is from. So 2 days later, we stayed in Knoxville. They took me in for surgery. I remember waking up in the middle of surgery, blood everywhere, freaking out again, like panic, anxiety, all the things. And I just remember when I came out of that, not being able to move my head. I wasn't able to turn my head. I wasn't able to move, look up, look down, nothing. Like, I had this saran wrap around my throat like this. I couldn't talk a lot because it was very sore. I was in a lot of pain, and that was the first experience that I had with opioids. So they had prescribed morphine in the hospital, and I was having hallucinations and all the side effects that would come with morphine as a 17-year-old. I saw like army soldiers coming into my room with guns, and I thought like I was being ambushed. It was a super strange situation with like pain medicine. And I remember my mom crying frequently because it was just like a scary situation for all of us, of me being in the hospital, me not feeling well. I got checked out of the hospital the day after that, though. Luckily, everything looked okay. We went home, drove home. My dad being dad, right? We're already 2 hours away. We lived in such a small town. We stopped at Bass Pro Shops. They put me in a wheelchair and pushed me around, which is fine because I felt fine at that time because I was on drugs. We went around Bass Pro Shops, got back in the car, went home. I couldn't eat anything except like ice chips. I felt terrible. So there was that. We went back about a week later. He took the steri strips off of my thyroid, and they pretty much told me I was fine. Go home. You'll get back to normal. The pain was pretty much there for several weeks after that, but it started to get better. I was starting to be allowed to move. But they told me that I had to be on thyroid medication every single day for the rest of my life. At that time, they gave me levothyroxine, which again, I'll talk about this in a future video, but they gave me levothyroxine at that time because before, when it was swollen, what I didn't mention is I did try medications and nothing worked. I tried the diet changes, nothing worked, and all the stuff. So it took probably 4 or 5 weeks before I was able to kind of like consciously come to and like feel a little bit more normal. But like during this time frame, I had to miss my senior like trip. I wasn't able to go to, well, I take that back. Actually, I went to junior prom or senior prom. You can tell my memory is a little off with this. I can't remember which one I went to, but I do remember that I was really limited on like the functionality that I was able to have because of that surgery. And I remember the emotions of it being, because as a 17-year-old, I had this nasty scar on my throat. And I say nasty because you see it now how it looks, which is fine. It's like really hard to see. But initially it was bright red and it had a really puffy white like skin on top. And so they had done the stitches and I had a lot of what's called, I think ketones, keloids, one of those things. Again, I'm going to do all this research and bring that to you in another video. But I had this puppy scar where I over like create scar tissue and it just was not cute. It wasn't a cute look. I didn't like it. And I was just really self-conscious about it. And there were so many things at that time frame that I remember having questions about, but not feeling like I could ask because the doctors just shunned me away. And they were just like, yeah, you have Graves' disease. You're going to have surgery and then you're going to be fine for the rest of your life. And nothing was how they said it was going to be. They said surgery would be fine. I would be fine with the medicine and I wouldn't have any pain. They told me that I would recover just fine and be fine for senior trip. But I now, at 29 years old, 12 years later, am recognizing that that was the root cause for the majority of my anxiety. That's been the root cause for the majority of my depression. And that's also been the root cause for a lot of the things that I've learned over the years that I've struggled with: menstrual issues, fertility issues, mindset issues, issues with libido, the issues with my foods, like foods and stuff, like all of these things that should have been addressed and they never were. So I'm excited to dive into that. But that's really kind of like my story with having a diagnosis of Graves' disease, what that looked like at the time, and having surgery. And I'm going to continue to share with you some of the stats, some of the numbers, some of the information about moving forward and what all of this looks like in the healthcare realm. But thank you for tuning in.